increasing your milk supply. Most mothers are able to provide their babies with all the milk they need. However, if your baby is not thriving as she should, feeding her more effectively will help improve your milk supply to meet her growing needs. This video will show steps to improve your milk supply and your baby's feeding. First, improve your baby's attachment. If your baby is attached only on your nipple, your baby is getting very little milk. But when she takes more of your breast in her mouth, milk will come easily. Deep attachment helps your baby suck effectively, enabling her to remove more milk from your breast. This stimulates your breast to make more milk, enough for your baby's needs. Many babies thrive even if they are not well attached, because most mothers make a lot of milk at first. Over a few months though, if your baby is not stimulating your breasts, your milk production can slow. Your baby will start to be restless at the breast, pulling or slapping, and may reject your breast entirely, or feed for very short periods of time because the flow of milk is not meeting her needs. To prevent that, try to improve your baby's attachment right from the start, when your baby is a newborn. Next, do breast compressions. This will improve your flow of milk and keep your baby drinking. If your baby falls asleep quickly at your breast, improving her attachment and then compressing will start your milk to flow. Your baby will start to drink and wake up as the milk comes. Compress by pressing your breast between your thumb and fingers as far back from your nipple as is comfortable. Pressure should be firm but not painful. Compress while your baby is sucking and rest while your baby is resting. If your baby is drinking well, there is no need for you to compress. And last, feed your baby often and well. In the early days after birth, your baby will be hungry often, at least 10 times between one sunrise and the next. A newborn's stomach is small, so they need to feed often. Your baby can have a good feed and be hungry again quite soon. Her interest in feeding may be awakened by holding her close to your breasts. Watch for her feeding signals, moving her lips, bringing a hand to her mouth, and turning her head from side to side. Feed your baby whenever you see her feeding signals day and night. There is no need to time how long your baby feeds or remember which breast she was on. Some babies are fast feeders and others are slow. Your baby will know when the flow on one breast has slowed and she is ready for the other side. As the flow of milk slows, your baby may come off your breast on her own. Hold her to your chest. As you patiently wait, your baby may start to signal her hunger again. She was interested in going back on the breast twice more. Full at last, your baby may fall asleep and drop off your breast. At times, your baby may suddenly want more milk than before. This is normal. It means your baby is growing, and so is her hunger. As you follow your baby's signals, feed her more often. This will naturally increase your supply of milk. Do not give your baby water, sweetened water, tea, honey, breast milk substitutes, or anything else. They can fill up your baby so she won't feed as much at your breast. This will reduce your milk supply. They can also give the baby harmful germs and make him sick. Instead, follow your baby's signals. Feed her often whenever she signals her hunger. After a few days of extra feeding, as long as your baby is well attached and you are using compressions to make every feed effective, your milk supply will grow to meet your baby's needs. Breast milk is best. For the first 6 months of your baby's life, this is all she'll need. It has all the nutrition in just the right amounts for your baby to grow and thrive. Remember, almost all women can produce all the milk for their baby's needs. Use compressions to improve your flow of milk. When your baby is well attached and fed as often as she's hungry, you will make plenty of milk.